In a recent article in the Gleaner newspaper, doctors have been complaining that they are not being offered any jobs. This has come to a surprise to many readers as we are in a pandemic. Joining us now to shed some more light on this situation is Dr. Elon Thompson, president of the Jamaica Medical Doctors Association. Good morning, Doc.
Morning, Doc.
Morning, good morning, Empress. Morning to you,
Wow.
Empress.
Doc, let me give you the floor. Just open up and tell us what's the truth.
Um, the truth is we have 102 doctors who are currently not employed. I mean, there is no, the employers always have the upper hand when it comes to employment, clearly. They will employ who they want to employ. But I think this is a bit unprecedented where so many doctors, as far as in my medical career at least, where so many doctors have been unemployed. So it is a little disturbing. Most of them are young persons who would have thought that they would have been employed in the public system still.
So, Dr. Elon, we're talking about junior doctors here?
Right. So we're talking about doctors who are transitioning from senior house officer. So how it is, you graduate from medical school, you do 1 year of internship, and then you do 1 year of senior house officer, which is a prerequisite for going into a postgraduate program into the University of the West Indies, or for continuing as a MO1 in the public system.
Okay.
So these are persons who are transitioning from the senior house officer year to the medical officer grade 1.
Yep. I know you haven't been the president forever, but as far as you know, has this ever happened before in anything like this?
I have been informed that in the 90s, I believe, something similar has happened. The interesting thing, though, is I don't think it has been so many doctors. And part of the issue is also the University of the West Indies is putting out a lot of graduates, a lot more than probably 20 years ago, for sure. And these numbers are increasing, and once they continue to increase, we're going to be faced with a similar issue in the years to come. What the Jamaican Medical Doctors Association is saying is that we have to know how we're going to treat with this matter and put things in place to push on the blow for the doctors.
Here where I find this strange, because as Empress said at the top of the interview, we're in a pandemic. And I can remember reading about nurses that they wanted to bring out retired nurses because we need all hands on deck because of this. I find it very strange that in a situation like this, you don't need all the doctors who are available.
Yeah, and then the interesting thing is that the nurses have an opposite issue because they are currently short. And here we are, we're faced with an excess of doctors who need employment. So I think we had a meeting with the ministry and the regional health authorities and the University Hospital of the West Indies administration yesterday. And I'm hoping that out of that meeting, a realization can be understood that this matter is not going to get any better. It's not going to go anywhere. Like all problems, they are not going to go away until we find solutions for them. So I think this is one of the issues that really need a solution. It may not be short term. And, we had a meeting last night with the doctors who are affected, and they're aware, they know, they understand. They have no entitlement feeling. And I was, I was pleased to know that they didn't have this sense of entitlement. They didn't have any fears about them. They just wanted to try and see if there's any way that they can get some employment.
All right, Doc, I have to ask you. I know there's a COVID-19 pandemic, but I am wondering, is there really a health crisis? What is the patient intake looking like? Is it more than we've seen in the past?
I think we have to have numbers to look at that. The Ministry of Health is better positioned to answer those questions with regards to the numbers. We can tell you what we're seeing on the ground. We know that persons are going to be more confident coming out once a bit of the restrictions are lifted, once they see that the country is starting to open up a little bit more and more persons over probably 65 are going to start coming back to the health facilities. So we know we're going to go back to pre-COVID numbers. In terms of crisis, I would never tell a Jamaican citizen per se that we are not in a crisis, but I would say to them, if you have a need for healthcare, you should seek it.
All right.
Because when we say crisis, sometimes, it deters people from seeking care in the health system.
Let me ask you then, I don't know if you have the numbers or the data, but I was speaking to a friend who is also a doctor in the public clinics, right? Who says they see sometimes on average 3 or more patients with gonorrhea. Do we have a sexually transmitted infection challenge in this country? Because I'm really wondering how many people are walking around with gonorrhea, syphilis, herpes. What do we know about that? And what do you know from the Medical Doctors Association? Is there a crisis with sexually transmitted infections?
All right. So I'm a urologist, and how the endpoint of gonorrhea is an increase probably in the number of urethral strictures, which is a narrowing of the passage as a result of the infection that gonorrhea is. So I have not seen, and I don't know if my colleagues have seen, an uptick in number of stricture disease. So the amount of patients presenting with difficulty urinating as a result of narrowing of the passage. So I don't know. I would really have to find out from the primary care facilities if this is so in terms of an increase in the number of cases.
Well, let me then ask you, sexually transmitted infections, are the numbers alarming in Jamaica? Do you know what the doctor, you as a urologist, do we have a lot of sexually transmitted infections in Jamaica?
Personally, I don't know if I would necessarily see these patients as a specialist. I think primary care is where I could get those figures from. They would present to the primary care system. I haven't gotten any reports from the primary care doctors that there is an upsurge in STIs.
Okay.
But I would need to back that up, of course.
Dr. Elon, let's go back to the shortage or the doctors not working. The medical folks who came from Cuba, how does that sit with you when we are bringing in doctors and your doctors are not working? And the second part of the question is, these folks who came from Cuba, are they specialists? And is it because we don't have these specialists in Jamaica why they're here?
Again, that would need some examination. The real crux of the matter in the meeting was the availability of spots for the 102 unemployed doctors. We didn't really delve into the Cuban situation, but based on what we heard in the media and a little bit of what was discussed before, these are specialists that were received from Cuba. I don't know what the terms of the engagement were, how much it is costing the government. I don't know if they're filling positions that would have normally been filled by doctors here. And I don't know if it's the same level of doctors that we are talking about who are currently unemployed. Because I stated that it's really the MO1 level.
Yep.
So I would need some information in that regard, whether the positions that were filled by the Cuban doctors were the ones that would have been filled by these Jamaicans. So, I mean, I can say that the impression that we got is that this is not the case, because they did highlight the fact that these were specialists. And to me, specialists are normally MO3 grade doctors, sometimes employed as MO2, sometimes employed as MO1. I mean, this is all a part of the systemic problem that currently exists in the health sector, and that needs to be restructured.
Okay. Earlier, in response to a question that Empress asked, you said they are excess doctors. You used the word excess. Does that mean that there are too many doctors for our population here?
Well, I don't think there are too many doctors for the population. What I think is there are too many doctors for the posts that they have available for them. We have been highlighting that the cadre of posts for medical officers needs to be reformed. It needs to be updated. For years now, we have been saying this, and for years it has not been done for whatever reason. We keep getting excuses for these problems, but I keep saying, if you don't deal with that problem, it's not going to go away. It's going to continue. It's going to grow. It's not going to get less. It's just going to get worse. And you have to confront these problems. I mean, the tone of the meeting yesterday, the ministry and the officials, was that, we probably need to fast track how we reform the CADA, increase the number of posts available,
Yep.
highlighting the problem now.
Tell me what you said at the top, that there are too many doctors for the positions available?
The posts that are available. So
Like-
every post in the government system, in the public sector, is budgeted for. So what happens is, if you need to increase the number, and I think the minister has alluded to this in terms of this, is you have to make a supplementary submission to the Ministry of Health, which I think needs cabinet approval, to pay the persons who require the extra positions.
Okay.
So I think it's not an excess of doctors. We do not give that impression. What we have here is a lack of planning to accommodate the doctors,
So
because we are still understaffed.
Doc, we have to leave it there. Why don't the doctors go into private practice? Or can they go into private practice as an option? Final question.
So that's a good question, Empress. What I would say, and I said the same thing to the minister. These are young persons. These are 25, 26-year-old persons, most of them, who to start a business in private practice takes some planning. It takes some amount of resources as well. These are persons who have student loans paying still. These are persons who have bills. These are persons who have families who invested everything in them, who depend on them. The situation right now may not be the best fit for them to do private practice. And this is why a lot of persons don't enter private practice until they are prepared, whether financially or from a management standpoint, when they have more time in the system and they're better able to manage their time and able to manage situation and businesses, and then they embark on it. But a lot of these persons are young persons still. This is 2 years after medical school.
Yeah.
And it's not done for all of them, at least.
Yeah.
Some of them, yeah, but it's 102 persons that way.
That's a lot. We wish them the best, though. Thank you, Doc.
Hang on. Empress said final question. I'm sorry, Doc. Final question from me.
Final.
Very quick answer. What are these doctors doing now?
So I had a meeting with them last night. They're at home. They are, we have to help to lift the spirits. They are in good spirits. This group, having met with them last night, this group is a dedicated group. I got that impression. There was no entitlement. I know the public has this impression of doctors sometimes that they feel entitled, and there was none of that here. And they are just, they understand what the situation is. It's not like they're oblivious to the fact that, they are currently no posts.
But they're not working. They're not working.
Right, they're not working.
Right.
And we're still trying to work to get at least a fraction of them
All right.
employed.
We have to go, my friend. Thank you very, very much for speaking with us this morning, and I hope everything works out for your group.
No problem at all. Thank you.
And Doc, when he comes to you, give him a discount, okay?
Well, I'll always take care of Neville. You know that.
Thank you very much, sir. Dr. Elon Thompson, President of the Jamaica Medical Doctors Association.
And after the break, my people, we make a fun stop with Neville and things that boggles his mind. Smile Jamaica continues with this quick break.